Good afternoon, this is Dr. Do again. This video is still on the alphabetic list of the problems, still on the B list. Today I'm going to talk about the special, quite common problem, which is a common word, non-medical word, blackout. Basically, it's fainted, right? So what kind of causes for blackout or fainted need to go to the emergency room? It happens to many of us, young or old. The blackout or the faint warrant emergency visit is like older people, especially occurring not just once or twice, frequently, and with comorbidities, which means other medical problems like a history of diabetes, high blood pressure, history of stroke, history of any other problems like either kidney disease or liver disease. Any of those, if you have the episode of blackout or faint, you need to see either frequently or just once or twice. You need to go to emergency room to check it out. What kind of faint or blackout is not that serious. It happened to all of us, pretty much, for those young people, and you know you do not have any medical problems. And the blackout is not because of your currently at the vigorous activity, but probably you know you had a previous night not sleeping well, and from changing position from lying down to stand up, you suddenly feel fainted or lost consciousness. This kind of people, it happens. It could happen to normal people. So, if this is the case, you know it, and you can just rest, drinking fluid, and to recover. It is okay. But majority of case, if you have any episode of blackout, especially if not just once or twice, even though you know you have the stress or not sleeping well, if cause frequently episodes of blackout or faint, you need to check it out. Even though you know you did not sleep well, but if this ongoing insomnia also impair your function and affect your life, so that also you need to see your physician, even though not an emergency. Okay, so basically, what are the causes of this blackout or faint? The worst scenario, the worst case is like elderly people had heart problem, hypertension, diabetes, and you taking the medications. Either you take too much of your blood sugar medication, cause the hypoglycemia, that can cause blackout. Or you had heart problem, you're taking medication, for example, medicine for hypertension, and too much cause the hypotension, which is blood pressure is too low, can cause the faint. And if you had hypertension for a while, you did not know your heart problem, suddenly developed arrhythmia, can cause this faint episode. All of these are very serious. You need to see the emergency to treat it. If it's hypoglycemia, you'll be infused with the sugar, and you will recover. And if it's blood pressure too low, you will use medication. You'll be given medication or fluid to raise the blood pressure up. Or if the arrhythmia, then you need to be treated in the emergency room. Or young people, it could happen to young people, young person, like in addition to those stress caused faint or blackout, young person may have this episode of faint, indicating you have the heart problem, but just nobody tell you, you did not know. So this might be an initial sign to diagnose your heart problem. So if that's the case, like I said, if you have fainted or blackout history, particularly if no known cause distress, like you will not feel stressed, you're not feeling insomnia or sleep deprived or something, but just suddenly came as a normal daily routine and you have those blackout moments. No psychological cause, no stressful. If that's the case, you need to see your doctor, even though it's not emergency, but urgent, or call your physician to schedule, to check it out, to see whether you have any heart problem. Very likely is the cause. And the other situation scenario is for older people or middle-aged older people. You know you have kidney disease. That also may trigger this episode, because the kidney disease quite often causes the imbalance of the ions. Some of the ions, like sodium or particularly potassium, if that is abnormal, or calcium abnormal, may cause this episode of blackout or faint. Or neurological cause, of course. People know or unknown history of heart disease or hypertension, suddenly fainted or blackout, could be a sign of stroke, or it's called the temporary. It is the transient ischemic attack, TIA. So it's a sign of stroke. So if that's the case, cause fainted, lost consciousness, or blackout, you need to see the emergency, because the test and the time is critical if that's the case. All right, so this is the blackout. I just briefly introduced some common causes. What kind of problem you need to see the emergency, what kind of problem you need to call your physician, and what kind of situation, scenario you can manage at home. For those can manage at home, like young, no known any disease, and the trigger factor for this episode is very clear. You are under stress, not sleeping well, especially changing position from lying down to sitting up. So if that's the case, you can do some maneuver like I talked last time. Either hold your deep breath and hold it, or you massage your cervical area, so then to relax and to ease, to change this autonomic nerve that's probably caused by this imbalance of autonomic nerve system. Okay, so if you do this maneuver, like hold the breath or to massage your neck, will just change the system back to the autonomic nervous system back to balanced. So this is the only simple scenario you can manage at home. Other than that, if frequently episode, elderly, known or comorbidities like hypertension, diabetes, kidney disease, or even blood problem like anemia, all of these can cause the episode of blackout or faint. So all of these you need to call your physician, either urgently, emergency, or call them to schedule appointment as soon as possible. So that is the video for today, and thank you for watching, and I will see you next time.